Thank you so much for joining us today. We're so excited to have you.
Thank you.
Can you go ahead and give us a brief introduction?
So, my name is Dr. Jonathan Thomas, and I am an emergency room physician at Piedmont Midtown Medical Center.
Okay, perfect. So how long have you been there at Piedmont?
So, it will be 3 years in July.
Awesome. So how long have you been in the field in general?
So, I actually finished residency 3 years ago. So, I've been an emergency room doctor for 3 years. Well, technically 6 years if you count residency, but 3 years
Okay.
as an attending physician.
Okay, perfect. And we'll get into that in that next question. The next question is like, what type of education or training is required for your career?
So for a physician in general, typically you do 4 years of undergrad. It can be less or more depending on how many classes you try to fit into your schedule.
Mhm.
And typically it's 4 years of medical school, and residency can vary. For emergency medicine, it can be 3 years to 4 years depending on which program you go to. But for most specialties, it's going to range anywhere from 3 to 6 years.
Okay, perfect. So get into that. So where did you said you had to have a bachelor's degree, a 4-year degree. Where did you go and what did you get your bachelor's degree in?
So I went to Edinburgh University. I have a bachelor's degree in biochemistry,
Okay.
and I did medical school in Cleveland, Ohio, at Case Western University, and I did residency at Emory.
Okay, perfect. That was 3 years at Emory.
Right.
Okay, perfect. So what led you to this career?
So, I mean, I've always been pretty good at math and science, and always wanted to help people. So, I mean, being in medicine just kind of helps you combine those two into something that you actually enjoy doing.
Okay, perfect. So what does a typical day consist of in your field?
So, a typical day, I mean, I would just say in emergency medicine specifically, it's typically what we do is we triage, stabilize, and treat patients. So by triage, I mean, it's a fancy word for saying categorize patients that come into the emergency room from the least sick to the most sick. Obviously, we want to see the sickest patients first, make sure that they have all of their needs tended to, whether it be, their vital signs, if any are abnormal, low blood pressure, their oxygen levels are low, we address that. Once we stabilize these patients, we at least try to determine that they don't have anything emergent and an emergent condition that needs to be addressed, and then disposition them. And that's just a fancy word for saying, can this person go home or do they need to stay in the hospital?
Okay. So let me backtrack really quick. What made you choose emergency medicine?
That's a good question. I actually didn't want to go into emergency medicine. I actually wanted to go into pediatrics. And I did a rotation in emergency medicine in medical school. And after that, that's what I wanted to do.
That's perfect. So what led you to say that this is what I want to do?
Well, I mean, one, it's fast paced. I don't think I've ever done an emergency medicine shift when I was training, when I was in medical school, that dragged it. An 8 hour shift seemed like I was only there for an hour. Every other rotation that I did in medical school essentially dragged out for a really long time. So after doing the rotation there, I was like, okay, all right, this is what I want to do. And honestly, I don't think I could really tolerate doing anything else in medicine. So
Okay. So what are the other rotations that you ended up doing?
So, I mean, you have to basically rotate in every specialty in medical school from, emergency medicine to pediatrics, internal medicine, surgery, obstetrics and gynecology, pathology, basically everything, because you have to have a broad scope. And you have to be able to understand all fields of medicine, even if you do end up going in a particular field, because you need to understand how that particular field plays into your specialty. So,
Perfect. And I appreciate you saying that because our kids think, okay, I'm gonna be a doctor and that's it. Like this is the only thing I'm gonna ever touch. This is the only thing I'm ever gonna see. So thank you for letting them know that they will see like everything. So what did I already ask you? What do you enjoy most about your career?
what I enjoy most. So I think what I enjoy most about emergency medicine specifically is that, one, like I said, it's extremely fast paced. You never know what's going to come through the door. Every day is different. Every case is different. Every patient is different. Every minute is different. So, it's a lot different from going to a job where you're just doing the same thing over and over again. It takes, a high level of critical thinking, but it's really rewarding.
Okay, perfect. So what are some challenges that you faced in your role?
As far as challenges, I think, and this isn't something that's specific to me. I think this is, something that's common among physicians in all specialties. It's really the burnout. Like I said, it does take a lot of critical thinking, and it can be really draining mentally.
Mhm.
And and then our schedules can be really, you know, demanding. So I think that's probably the biggest part, is trying not to get burnt out and still, manage your patients and approach your patients in the most idealistic way possible.
Okay, perfect. So tell me about that. Like you're talking about your schedule, like, because our kids think, oh, okay, you work 9 to 5, you 40 hours a week. Is that what you typically do? Like 5 days a week? What is it?
So that's another thing I like about emergency medicine, because it's essentially shift work. I'm never on call. I come in for a specific amount of time. I mean, plus or minus maybe a half hour to an hour, depending on, how the day plays out.
Mhm.
But typically I work 12-hour shifts, and I work 15 days a month. So, and when I'm home, I'm home. Nobody can call me and tell me to come in. Now, it's not the same way with a lot of other specialties. Things like surgery, you do have to do call, but in emergency medicine, you don't have to.
Okay, perfect. So how do you see your career um and or the hospital in general evolving in the next 10 years?
So the core and fundamentals of emergency medicine really don't change much.
Mhm.
The because people are still going to have the same illnesses. They're still going to have heart attacks. They're still going to have diabetes. They're still going to have brain tumors, and they're still going to get into car accidents. So the core isn't going to change. The fundamentals aren't going to change, but the way that you treat patients is going to change. And when I say that, I mean the technology. So, for example, 20 years ago, ultrasound wasn't a big part of, which is an imaging modality that we can use, at a patient's bedside. That's really quick. It wasn't something that was popular among, just physicians doing it at the bedside 20 years ago. But now, my training incorporated a lot of ultrasound. So the difference between me and another physician that, may have been practicing for 20 years is that I can operate an ultrasound with no problem, and they might not know how to. And it's just something that allowed me to determine, if a patient has a certain, illness faster than would be if they had to order a routine ultrasound for somebody to come from home to do.
Mhm. Perfect. So what kind of person do you think is most successful in your field?
So, I mean, it's the same thing as, you hear all the time. You have to be passionate, you have to want to, help people. But I think as far as emergency medicine goes, being, on the physician side, it's kind of like, you hear football players say it's good to have a short memory. And by that, I mean, you know, sometimes you're going to have a bad case. You're going to have a tough case where a patient might not have a good outcome, but you can't dwell on that and let that carry over to your next case, because that might affect your patient care. So you got to have a short memory, and you got to be able to move on to the next case.
Okay, perfect. And I like how you stuck in the passion for it as well, because we've been talking about to our kids about turning their passions into their careers. So it doesn't feel like you're working and like because you enjoy going there and you don't dread it. So perfect. And that short memory, because sometimes our kids like to hold on to stuff and hold grudges and get angry and stay angry. So short memory. I love it. They can start practicing now. So, what does communication look like in your field?
So, I mean, communication is definitely important, because, I mean, medicine in general is just a collaborative field. So,
Mhm.
not only, do we have to do an interdepartmental or interdepartmental collaboration between, me and other specialties such as, cardiologists, if a patient is having a heart attack, or a neurosurgeon, if a patient is having, a large stroke, or, a big, bleed inside of their head, or something that requires some type of neurosurgical intervention, down to the department itself, communicating with the nurses and the techs, making sure that things are getting done for patients, making sure that we communicate if a patient is doing well, if a patient is not doing well, because things can change in an instant. And it's always good to make sure that you have that good communication, so that way things don't slip between the cracks.
Perfect. And you touched on this a little bit more, but let's dig deep. What kind of technology do you use in your field?
So, I mean, like I said, we use a lot of technology. I mean, as far as, the documentation, We use an electronic medical record system. And the good thing about that is hopefully within the next 10 to 15 years, there'll be a nationwide patient database that'll allow me to see what somebody had done as far as, their medical care at another hospital, whether it be in the same city, same state, or even a different state, without me having to call around the different hospitals to try to figure out that information. Again, like I was saying, there's different types of technology that we use that changes, that allows us to actually treat patients, like I said, ultrasound, different types of stabilization tools, but medicine is always changing.
Perfect. So what kind of classes would you recommend for a middle school or a high school student to take if they're interested in your career or one similar?
So I think a lot of, students in high school, they kind of get hung up on making sure that, they're ahead of, ahead of the group as far as, math and science. And that's good. It's always good to make sure that you have a strong foundation in math and science when you go. But at the end of the day, even if you haven't taken certain classes, like you haven't taken college prep or advanced calculus, pre-calculus, or college prep biology, chemistry courses, once you get to the undergrad level, most programs, they have a track that's specific for patients that are a little bit behind. So if you have, if you haven't taken pre-calculus or calculus, you can take the, and I hate to say it this way, the remedial courses to actually build yourself up to that point. Because, so no matter where you are, if you have a passion for that, when you get to the college level, you can get there. So, so just, I'm one thing I would just say, one, and enjoy your time. And while you're in high school, if you want to take the more advanced classes, that's fine. But if you don't want to, if you don't want to take those advanced courses and you want to transition to that once you get to the college level, that's fine too.
I like that. That don't give up. Don't put a time constraint on it. Like yes, it says it's a 4-year degree, but it can take you 5 or 6 or
right.
whatever.
I think that's really important too, because a lot of students, they get into or they let their advisors kind of force them into doing things that they're not ready to do. And, that was something that was really important to me coming out of undergrad. Just my, the timing of the test taking that I had to undergo. And, some of my fellow students, they let themselves be pushed into uncomfortable situations and didn't do well on certain exams. Whereas me, I took my time, and once I was ready, I took certain exams and I did good. Versus you taking an exam on somebody else's time, not doing well, and then having to take that exam again, which isn't going to look good on your application. So
that's perfect. That's perfect advice. And not just saying you have to be forced into it. You have to have that jam pack. Boom, boom, boom. I love it. Perfect. All right. So last thing, you gave some great advice just now, but do you have any other advice that you would like to give for our students here at Richards?
So I would just say, whatever you decide to go into, whatever you decide to study, or if you decide to go to college, if you decide to do some other type of vocational track, just make sure it's something you're passionate about. Because choosing, I feel like a lot of students, or a lot of just individuals at baseline, they like to choose careers based off of the wrong reasons, and by that I mean like financial reasons. How much money are they going to make? But at the end of the day, that's something you're gonna have to do every day. So if you're not passionate about it, it's not something you enjoy doing, then you're gonna be miserable. So I would just say, do something that you enjoy doing, and that's pretty much it.
That's perfect. Well, thank you so much for your time.
Thank you.